Hello, thank you so much for joining me. My name is Ginger Cochran. I'm a registered dietitian nutritionist, also a certified diabetes education specialist, and certified exercise physiologist, focusing on women's health, specifically gestational diabetes management. And I am so excited that you're joining me for my gestational diabetes course. This is my four-pillar approach to managing gestational diabetes. I've worked with thousands of women, helped control it through diet, and if needed, with medications. But my first approach is focusing on diet, lifestyle. My four-pillar approach has been proven effective with many moms. And even if you need to start medication, people tend to be on a lot less as long as we do this lifestyle approach. First of all, we're going to start on what does having gestational diabetes actually mean, and going through some things of what to expect once you get gestational diabetes with your clinic, your OB, and some kind of guidelines. Let's move on. All right, so who gets gestational diabetes? Well, gestational diabetes doesn't really discriminate. I've seen it in all ages, all sizes, all athletic abilities. About 1 in 8 pregnant women in California tend to get gestational diabetes. In my specific area in California, and that's going to vary by state to state. My area in California, it's probably closer to like 30%. It's a pretty high percent of the population. Every year over the age of 25, your risk goes up a little bit. It's just because our pancreas aren't as efficient. I tell women all the time, I'm 38. If I got pregnant this year, I would probably get it too. Perfectly healthy diet, very active, but every year over the age of 25, our risk just goes up. Having diabetes in your family. So if you have any diabetes in your family, even if it's like your grandparents, that does put you at risk. There might be a genetic component to it. If you had gestational diabetes prior, if you had a baby that weighed more than 9 pounds, or born with birth defects as well. Gaining an excessive amount of weight during your pregnancy can also increase your risk. Now, don't beat yourself up. There's a lot of other things that contribute to that. Certain ethnicities are at a higher risk as well. Women who have polycystic ovarian syndromes, well, with that, there already is a little bit of insulin resistance going on there. So when the hormones of pregnancy hit, there's just a lot more. And we'll go over what insulin resistant is in future slides. And having a history of miscarriage or stillbirth is another risk factor. But sometimes it just happens. You can have no risk factors, perfectly healthy, and a gestational diabetes just occurs. You are at a higher risk in the next pregnancy of getting it, but it's not guaranteed. So you'll get screened again in your first trimester the next time you get pregnant and see how your body is doing then. So is gestational diabetes bad? There's a lot of fear, a lot of guilt, a lot of emotion comes with that gestational diabetes diagnosis. If we keep your numbers normal, the risk of any of those complications, the scary things that your doctor might have talked about, goes down to the same risk as in a normal pregnancy. So that's why a lot of doctors really focus on that blood sugar control and those numbers and checking your blood sugars. If it's left untreated, then yes, the risk severely goes up. Unfortunately, some people don't take it too seriously. If you're taking this course, then I don't think you're part of that population. It does increase the risk of baby getting diabetes in their lifetime. The risk of hypoglycemia during delivery. So baby gets used to that constant supply of extra sugar. They pump out insulin from their tiny little pancreas to compensate from the too much sugar coming from mom. Then once you deliver, they're taken out, but their insulin's still pumping. You still that sugar that they're getting from mom, but they're now not getting it, and then their blood sugar can drop. Now, after delivery, their blood sugar is checked multiple times. They might be given breast milk or sugar water or something like that. That's something for you to cover with your OB. But as long as we keep your numbers normal, then that risk goes down. That baby will experience hypoglycemia at delivery. Baby has an increased risk for obesity as well. if blood sugars are out of control. Large babies. So if baby's getting too much sugar, just like us, we store it around the midsection. So if they're pumping out insulin to compensate for all this extra sugar happening, then they're going to store it around the midsection and they're going to get these big Buddha bellies. Those are a little hard to deliver, right? So you get this head out, and then if the belly is bigger than the head, sometimes they get stuck. So might cause nerve damage, traumatic for mom, traumatic for baby. But again, that's why you get these extra ultrasounds, which we'll talk about, and they'll set up a birth plan for you. But we watch your diet, check your numbers, and do the best we can with measurement of baby. That then goes into, the shoulder and nerve damage. That's usually because the baby's large and then they get stuck in the birth canal. And then increased risk for C-section. Again, that becomes, because of baby size or needing to induce or something like that. So that's, again, something to cover with your doctor, but those are some things that can happen when blood sugars are out of control. But again, that's why we focus on this 4-pillar approach. If medications are needed, we take them to keep these blood sugars within goal. All right, what are the signs of high blood sugar? Sometimes there's no signs. I do have many moms that can feel their blood sugar rising because many of us moms are very sensitive and we can feel every imbalance in their body, but there might be none. You might have no clue if your blood sugar is high or low. Feeling tired, which comes along with pregnancy, that could actually be a symptom of your blood sugars being high. As the sugar is trapped in the blood, it's not getting to where it needs to go, not getting to your brain, not getting to your muscles. So again, you might feel pretty tired. Thirsty. So if blood sugar is really high, your body wants to dilute that blood and flush it out. So increase thirst to help flush out that sugar. Hungry? Again, something that just happens with pregnancy. Hunger is going to go up and down. So if we're not getting the nutrients to where it needs to go, then we might feel a little extra hungry. Weak kind of goes with tired. But again, that sense of weak and tired, if we're just not able to nourish our body because the sugar is just staying in the blood and not getting to where it needs to go in our bodies, and then too much sugar is going over to baby. Frequent urination. So that's because of the extra thirst and urinating in and out. Dizziness can happen. Dizziness can happen when your blood sugar is high or low, or even just that rapid climb you might feel. I know a lot of moms that have that actual reactive hypoglycemia. So you do both. You go super high, still blood sugar is going to extra blood sugar is going into baby, and then super low if you have like a really highly refined carb meal, like let's say like pancakes or something like that. And lots of times those big fluctuations up and down can make you feel really dizzy. Headaches is we might not be getting enough sugar to the brain, dehydrated, lots of things could be causing a headache. And then sweaty. So sweaty can happen again with the highs and the lows, but that's that body trying to get rid of those sugars. But again, you might have no symptoms. You might be shocked when something makes your blood sugars a little bit high, or not surprised at all. Tune into your body. See if you start noticing based on your blood sugar levels when you're checking your blood sugar and any of these different signs that you might be experiencing. All right, now what is gestational diabetes? You got diagnosed, you're told you have gestational diabetes, but what does that actually mean? It's not forever. So gestational diabetes is just diabetes in pregnancy. Once you deliver the placenta, your hormones should return to what they were before pregnancy, and the gestational diabetes should go away. Of course, there's always that risk that it might continue, but that's why you get screened postpartum. What's causing the gestational diabetes are these hormones. These hormones, they might be causing you to not sleep at night. You're peeing constantly. You might have had food aversions or still having food aversions, or maybe there's nausea and vomiting. It's all these hormones associated with pregnancy. And we need these hormones. That's what's keeping this nice, healthy pregnancy. So it's that progesterone, cortisol, prolactin, human placental lactogen, and that estrogen, keeping this nice, healthy pregnancy. But specifically in that third trimester, sometimes we see it a little bit earlier. We get this surge of hormones and we're getting more insulin resistant, which happens in all pregnancies, whether you get gestational diabetes or not. It's just that it happens a little bit more in women that develop gestational diabetes. So your body wants to develop this insulin resistance with this surge of hormones. It's just that some women it develops into gestational diabetes, and we'll go more over what that actually means. All right, now what are the blood sugar goals? What are you're checking your blood sugar using this glucometer? What is it supposed to be? We want to check our blood sugar first thing when we wake up. Not after you brush your teeth, not after you took a shower. You want to wash your hands and check your blood sugar as soon as you wake up. If you wait, then it can actually make your blood sugar look higher. Like let's say you ran, across the house after a toddler, took a shower, whatever it might be, that actually can, make your blood sugars look a little bit higher. We want your number to be under 95. So specifically 65 to 94. And we want this at an 8 to 10 hour fast. So you can play around with your nighttime snack to help you meet that fasting hour. And we'll talk more about, dinner times, nighttime snacks and things in future slides. For meal checks, we want to check it 1 hour after you started eating a meal. So let's say you started eating a meal at 12, then you will check your blood sugar at 1 o'clock. Now let's say you just can't check your blood sugar 1 hour after, you're busy, or you're a really slow eater. I recommend this a lot with slow eaters, or if you've had like a gastric bypass surgery, so that's the weight loss surgery, and you just like kind of snack or eat a little bit at a time, then I would do the 2 hour check. So you would, let's say if you started eating your meal slowly at 12 o'clock, then you would check it at 2 p.m. And we want that number under 120. All right, so when we eat carbohydrates, and there's insulin resistance, we break down those carbs, just like you saw in the previous slide. The pancreas senses how much carb is in there, releases insulin, but the cells don't respond to some of the insulin, and sugar backs up. Now, your body does this a little bit already in pregnancy. It wants to do that because it wants to divert sugar over to baby. Baby's growing more rapidly. You're in your third trimester. You're growing, baby's growing. It needs extra energy. For some women, it could be many different reasons. Either they're not putting out enough insulin to compensate for the insulin resistance that their body's created, or they have some pre-existing insulin resistance. So then adding on the insulin resistance that the body's making for pregnancy, there's just too much. So now too much sugar is backing up, and then too much sugar freely goes through the placenta to baby. So then that's when we get those blood sugar rises. What we work on through diet is to slow down digestion. We talk about macro counting, balancing your meals, different food choices, and different ways to increase your response to insulin so that foods are slowly digesting, sugar is coming in, your body is still releasing to the insulin, but it gives it time to find the cells that are still working. That way, the right amount of sugar is going through over to baby. And that's when checking your blood sugars comes in handy, because we want to see fasting first thing in the morning, your blood sugar in there is under 95. 1 hour after you started a meal, under 140. If we see that's how much in the blood, then we know the right amount of sugars heading over to baby. Then if you can't take that 1 hour, we want to see at 2 hours after you've eaten that meal, it's in your stomach, you're digesting it, your blood is under 120. So when we're eating carbs, they're breaking down into sugar. And this is a view of different types of foods that contain carbs. So all of your fruits, Doesn't matter if it's blueberries, an apple, they all contain carbohydrates and they contain sugar, but they contain a combination. Either way, it's all going to break down to sugar eventually, which is what we call energy. And you saw on the previous slide, and then your pancreas releases the right amount of insulin and puts it into the cell. Your starches, they're going to be like bread, beans, any kind of bun, your corn, crackers, English muffins, oatmeal, like those overnight oats or regular oatmeal. Of course, cereals, any kind of like honey bunches of oats or anything like that. Your pasta or noodles, ramen, peas, popcorn, potatoes, rice, any kind of like winter squash, like your pumpkin, butternut squash, tortillas, and sweet potatoes. And then also you can see milk. So yes, milk contains other things like protein or fat in there, but a lot of it is mostly carbohydrate. So your milk, buttermilk, and your yogurts. Of course, yogurts are going to vary a lot, and we'll go over that in the course, focusing mostly on diet. All of these foods, though, it's going to take about anywhere from 10-20 minutes to break down to sugar. Carbohydrates break down the quickest in the system, and that's because its main role is to provide us energy. And you might be thinking, why does my doctor keep having me check my blood sugars after I showed them it looks good for 1 week? Well, things change, as you've already experienced in pregnancy. So you can see here, this is your graph of your insulin requirements in pregnancy. So basically, how sensitive to carbs you'll be throughout your pregnancy. If you look at that point of conception, you can see how that line actually dips down. So what's supposed to be happening is that your pancreas is rebuilding itself, making more cells called beta cells to make more insulin, getting ready for that surge of hormones that happens starting at that 20 weeks and then really peaks starting at that 28 weeks to 36 weeks. So basically, those first conception at 20 weeks, your blood sugar should be the lowest that they're going to be your entire pregnancy. So if you're getting diagnosed a little bit earlier, it's just something that you're going to have to track throughout the entire pregnancy because things are going to constantly be changing. It could be that you're able to control it through diet the first 20 weeks and then things change. Maybe not. There's no guessing or answers. I've seen women have high numbers in the beginning and control it through diet and they never have to start medication. I've seen it where all of a sudden it's 35 weeks and they have to start. Or, it's just every pregnancy is different. There's no guessing what's going to happen. That's why every week we continue to check. There might be a case where your doctor doesn't think you need to check 4 times a day. That's a conversation to have with your doctor. The things that I find the hardest control is those fastings. So I recommend always checking your fastings no matter what other things are going on. So definitely at least don't miss those, but check according to what your OB has recommended. But you can see here, definitely around that 28 weeks when people typically get diagnosed, and it peaks around 36 weeks. Sometimes right before it might dip a little bit before delivery. Then once you deliver, you see that big drop, you deliver the placenta, and then things should go back to pre-pregnancy level. If you see that they dip a lot after that 36 weeks, then always tell your OB because that could mean a sign of something else that's going on.